Welcome back to Africa 54. Here is the latest news on the devastating Ebola outbreak in West Africa. Sierra Leone has taken the dramatic step on Thursday of quarantining districts where more than 1 million people reside in order to halt the spread of the deadly virus. Overnight, President Ernst Bai Koroma announced that Port Loko and Bambali in the north and Moyamba in the south would be quarantined. Meantime, just a short time ago, U.S. President Barack Obama reiterated his stance that the entire international community should be concerned about the ravaging outbreak.
As we gather here today, the people of Liberia and Sierra Leone and Guinea are in crisis. As Secretary General Ban and Dr. Chan have already indicated, the Ebola virus is spreading at alarming speed. Thousands of men, women, and children have died. Thousands more are infected. If unchecked, this epidemic could kill hundreds of thousands of people in the coming months. Hundreds of thousands. Ebola is a horrific disease. It's wiping out entire families. It's turned simple acts of love and comfort and kindness, like holding a sick friend's hand or embracing a dying child, into potentially fatal acts. If ever there were a public health emergency deserving an urgent, strong, and coordinated international response, this is it. But this is also more than a health crisis. This is a growing threat to regional and global security. In Liberia, in Guinea, in Sierra Leone, public health systems have collapsed. Economic growth is slowing dramatically. If this epidemic is not stopped, this disease could cause a humanitarian catastrophe across the region. And in an era where regional crises can quickly become global threats, stopping Ebola is in the interest of all of us.
Well, in Guinea, the World Health Organization says the spread of Ebola seems to have stabilized, but a shortage of beds and resistance in affected communities means its advance is continuing elsewhere in that region. Well, although Ebola has taken center stage this week at the UNGA, Africa 54 health correspondent Linord Moudou, who is attending the assembly, has spoken with some of the key players in the global health community about other health concerns. And she joins us now on the phone from New York. Hello, Linord.
Hello, Vincent.
Yes, now tell us about the other health concerns that are being discussed on the sidelines of the UNGA.
Well, several topics indeed are being discussed. This morning I attended a gathering with UN Secretary General Ban Ki-moon, which was attended by some leaders, some African leaders, including President of Rwanda, Paul Kagame. Now, the meeting was to launch the MDG Advocate Leaders Report, which is a document that highlights successes and shortfalls of the MDGs over the past 14 years. The group of leaders involved in the project include President Kagame and also Mrs. Grachama Cheryl, who officially launched the report. The MDG goals number 4 is to reduce by 2/3 the mortality of children under 5, and the report highlights some of the progress, particularly malaria. Malaria, as a reminder, according to WHO, it's 627,000 lives that are lost every day due to malaria, and 90% of them are children under 5 in sub-Saharan Africa. I spoke to Mrs. Fatoumata Traoré, who is the executive director of Rollback Malaria, and she said that 103 countries in the world are malaria endemic, and child mortality in general has been reduced by 20%. treatment, which translates into 3.3 million children whose lives are saved, thanks to malaria control alone. And Ray Chambers, who is the UN Secretary General Special Envoy for financing the Health Millennium Goals, Development Goals, and malaria, says some progress have been made, as I mentioned earlier, such as the reduction of child death in sub-Saharan Africa from 1.2 million a year to less than 400,000 a year. This is significant. But he says that the hope is to get to less than 100,000 by the end of 2015.
Now, Linord, from what you're hearing, is there any indication that African leaders are really putting this at the center of their policies and agendas to ensure that they really reduce the malaria deaths across the continent?
Yes, Vincent, I have to say that there has been a momentum among African leaders to really tackle malaria specifically. We've seen President of Tanzania, Jakaya Kikwete, who was leading the President Malaria Initiative and was succeeded by Mrs. Ellen Johnson Sirleaf. And this initiative has really put at the forefront reducing deaths of malaria, and there have been tremendous successes.
Very quickly, what is the other health issue? AIDS and others were discussed too?
HIV/AIDS was on the agenda this morning. This morning there was a press conference with Mr. Michel Sidibe and Victoria Beckham, who is an international goodwill, who is now named International Goodwill Ambassador for UNAIDS. So during the conference, Mr. Sidibe says that the priority for the post-2015 agenda includes sustainable development as to bringing to the people at the center of the action and refusing exclusion and access to treatment for all. And he says that Victoria Beckham, as an ambassador, can help in this regard and other aspects, such as combating violence against women, which also leads to HIV/AIDS infection.
In a few seconds, are they concerned, though, that the spread of Ebola is undermining the efforts right now on the ground against malaria and HIV/AIDS?
Absolutely. Actually, Mr. Ray Chambers mentioned this when I was speaking to him. He said that although there have been some tremendous progress recently this year, they have seen the impact of Ebola that is really curbing the progress, because among other things, people are afraid to go to the hospital for fear of being diagnosed with Ebola. So when they come up with a fever, they stay home. It could be malaria. We don't know because we cannot diagnose them.
Well, thanks a lot, Linord.
You're welcome.
Now, be sure to watch Linord Moudou's health updates every Tuesday and Thursday right here on Africa 54.